Insomnia. This is the most common sleep problem, where a person struggles to fall asleep, wakes up frequently during the night, or wakes up too early and cannot return to sleep. It often develops slowly, triggered by stress, anxiety, overthinking, or irregular daily routines. Late-night phone use, caffeine, and inconsistent sleep times can make it worse. Over time, insomnia doesn't just cause tiredness, it affects memory, mood, and concentration, making even simple tasks feel heavy. People with long-term insomnia may also feel frustrated or worried about sleep itself, creating a cycle where the fear of not sleeping keeps them awake even longer. Sleep apnea. This condition causes breathing to stop and restart repeatedly during sleep, sometimes dozens or even hundreds of times in one night. The most common type happens when throat muscles relax too much and block the airway. A person may snore loudly, choke, or gasp for air without fully waking up. Even though they spend hours in bed, their sleep is constantly interrupted, leaving them exhausted in the morning. Over time, untreated sleep apnea can lead to serious health problems, including high blood pressure and heart issues, because the body is repeatedly stressed during the night. Restless leg syndrome. This condition creates a strong, uncomfortable urge to move the legs, especially when lying down or trying to relax. The sensations are often described as crawling, tingling, or pulling deep inside the legs. Moving the legs may bring temporary relief, but the feeling quickly returns. It usually becomes worse in the evening or at night, making it very difficult to fall asleep. People with this condition may keep shifting positions or walking around, breaking the natural flow of sleep and leaving them feeling unrested the next day. Narcolepsy. This is a rare but serious neurological condition where the brain cannot properly control sleep and wake cycle. People with narcolepsy may suddenly fall asleep during the day, even while talking, eating, or working. These episodes can happen without warning and last for a few seconds or several minutes. Some people also experience sudden muscle weakness triggered by strong emotions such as laughter or surprise because the brain quickly enters deep sleep. Normal rest patterns are disrupted, making both daytime alertness and nighttime sleep unstable. Sleep paralysis. This occurs when a person wakes up, but cannot move their body or speak for a short period. It usually happens during the transition between sleep and wakefulness, when the body is still in a relaxed, sleep-like state. During this time, some people may feel pressure on their chest or sense a presence in the room, which can feel extremely frightening. Even though it feels intense, it is generally harmless and passes within seconds or minutes. It is more likely to happen when sleep schedules are irregular or when a person is under stress. Night terrors. These are sudden episodes of intense fear that happen during deep sleep, often in the early part of the night. A person may sit up, scream, sweat, or move violently, but they are not fully awake and usually cannot be comforted. Unlike nightmares, they rarely remember the event afterward. Night terrors are more common in children, but can also affect adults under stress or sleep deprivation. They disrupt deep sleep and can leave both the person and those around them feeling deeply disturbed. Nightmares. These are vivid and disturbing dreams that usually occur during lighter stages of sleep. Often in the later part of the night, they can involve fear, danger, or emotional distress, and they often wake the person up suddenly. Unlike night terrors, nightmares are usually remembered clearly, and the emotions can linger even after waking. Frequent nightmares can make a person anxious about going to sleep, gradually affecting overall sleep quality. Circadian rhythm disorder. This problem happens when the body's internal clock is not aligned with the natural day and night cycle. The body naturally follows a rhythm that tells it when to feel sleepy and when to feel alert. When this rhythm is disturbed, sleep begins to feel out of place. This is common in people who work night shifts, travel across time zones, or stay awake late using screens. As a result, they may feel awake when they should be sleeping, and sleepy when they need to be active, leading to constant fatigue and poor performance during the day. Sleepwalking. This involves getting up and moving around while still asleep, usually during deep sleep stages. A person may walk through the house, talk, or perform simple actions without any awareness. Their eyes may be open, but they are not truly awake. Sleepwalking is more common in children and often decreases with age. While it may seem harmless, it can be risky, especially if the person leaves the house or interacts with dangerous objects. Most people do not remember these events once they wake up. Bruxism. This is the unconscious grinding or clenching of teeth during sleep. It often happens without the person realizing it, but signs may appear as jaw pain, headaches, or worn-down teeth. Stress, anxiety, or misaligned teeth can contribute to this condition. Over time, the pressure placed on the teeth and jaw can cause damage and discomfort. It may also disturb sleep quality, even if the person does not fully wake up during the night. Hypersomnia. This condition causes excessive sleepiness during the day, even after getting enough or more than enough sleep at night. People may feel the need to take long naps or struggle to stay awake during normal activities. Unlike feeling simply tired, hypersomnia creates a constant sense of heaviness and low energy. It can be linked to other medical conditions or sleep disorders, and often affects concentration, mood, and daily productivity. Snoring. This occurs when airflow through the mouth and nose is partially blocked during sleep, causing the surrounding tissues to vibrate. It is often louder when a person sleeps on their back or has nasal congestion. While occasional snoring is common, frequent and loud snoring can disturb both the person and others nearby. In some cases, it may be a sign of a more serious condition like sleep apnea. Even on its own, snoring can reduce sleep quality by causing brief interruptions in breathing and rest.